Thank you, Sarah, and I welcome everybody on board. I'm Clovis Kankia. I'm the head of Department of Biosecurity, Ecosystems, and Veterinary Public Health here at Makerere University. And today I'm going to be the host chair for this session that will run up to 3:30 p.m. This is one of the World Health Summits conference side meeting that is focusing on One Health. Our theme on One Health in Action, a regional rabies elimination activity. This activity is co-hosted by Health for Animals, Makerere University, MSD Animal Health, Rabies Free Africa, and the University of Glasgow. I'm the chair, and I'm joined by 6 presenters, whom I will introduce one by one as their time comes. I will start by giving you some brief background about this side event. The main objective of this event is to emphasize the visibility of the rabies elimination. Secondly, we would like to make sure to raise awareness of its impact on the most vulnerable communities, and also emphasize on the potential for rabies elimination to lay foundations for effective One Health systems, and tap into the opportunities to accelerate progress towards regional elimination of human deaths from dog-mediated rabies. Of course, this is a very, very important topic for discussion tonight. And the key objectives for our discussion, as I mentioned, is to raise awareness for the feasibility for elimination of all human deaths arising from rabies, and ensure that we achieve a zero target by 2030. The strategy led by World Health Organization, OIE, as well as FAO. Secondly, we aim to discuss the value of a coordinated One Health approaches for combating this neglected tropical disease, as well as harness on the potential benefits extending well beyond rabies control. With me in the house, we have Dr. Maria Flavia Nakanjako, who is representing the Commissioner of Animal Health at the Ministry of Agriculture, Animal Industry and Fisheries. And I'd like to introduce Dr. Flavia Nakanjako, and thereafter give her an opportunity to discuss with us a few areas in line with the Ugandan context. Dr. Flavia Maria Nakanjako holds a bachelor's degree in veterinary medicine from Makerere University. She has a master's degree in biodiversity, wildlife conservation and ecosystem health from University of Edinburgh. She's a senior veterinary officer in charge of wildlife, pet and marine diseases at the Ministry of Agriculture, Animal Industry and Fisheries. And for the past 5 years, she has been a focal person targeting with the surveillance for transboundary animal diseases and outbreak investigations. Currently, she's the focal person on rabies control at the Ministry of Agriculture, Animal Industry and Fisheries, and the coordinator for the in-service applied veterinary epidemiology training program, meant to train frontline veterinary doctors and veterinary paraprofessionals in the field of epidemiology, targeting on zoonoses as well as other animal diseases. This program is implemented jointly with the Food and Agriculture Organization of the United Nations. And she's also a One Health champion and formerly worked as a country administrator for One Health Central and Eastern Africa. I think with that, this is the right person, I must say, should be able to give us a full presentation within 7 minutes with regard to what impact has COVID-19 had on rabies program in Uganda. Also further, give us a discussion on how does the veterinary sector tackle rabies in Uganda, and could this be improved? What could be done to ensure that affected communities understand the risks associated with rabies and what they need to do to protect themselves? with that, I think, allow me request Dr. Flavia, who is representing the commissioner, to give us her talk. Flavia, you are most welcome.
Thank you, sir, for that, for that introduction. I don't know whether you can see my screen.
Yes, we do.
Okay. Thank you so much, Dr. Kansha, my professor, for my lecture. Okay. As I've already been introduced, those are my credentials. I would like to take you through briefly on what has been highlighted. I've made a few slides. I'll go through, but as I go through, you can also follow from your screens. Okay, as we all know, rabies is one of the key 7 priority zoonotic diseases. I hope I'm audible. Am I audible?
Yes, you are clear.
Yes, okay. Rabies is one of the 7 priority diseases in Uganda, and the government has the mandate. It's one of those few zoonoses where the government has the mandate to control the disease. And there are several legal instruments through which that is done, and one of them is the Rabies Act. So the government is mandated to procure vaccines, and this the ministry has done faithfully. Every year there is a budget set aside to procure vaccines in order to control rabies. But the veterinary services in Uganda are decentralized. So when these vaccines are procured, they are distributed to the different districts on request from the different district veterinary officers and the NGOs, for example, Big Fix Uganda, who is a key stakeholder in rabies control. So these vaccines, usually those district veterinary officers have annual work plans which they follow for rabies vaccination and other vaccinations, so animal diseases. So they follow this to carry out vaccination, and they file returns in form of reports, which they send back to the CBO. The effect of COVID-19 on the control programs, as has been requested, we've been requested to highlight on this. The major effects of COVID-19 on the control programs of rabies has been the laxity in what? In vaccination. Several districts were unable to follow their vaccination schedules because of the restrictions and the resource constraints. For example, during the lockdown in 2020, even now, people were not allowed to move. And much as they were saying veterinary services should continue to operate, some of those don't have transport means. They usually use public means and maybe hire motorcycles to take them to the field, and this was not possible during that time. Then also access to post-exposure prophylaxis, those who have been bitten by suspected rabies dogs was not also possible. Some of them could not follow their schedule because of the restrictions. So that highly affected the rabies control during the lockdown. I've referred to 2020 because the one of 2021 has just started. So that really affected, and it had a spillover effect because in September and December, we had reports of increase in reports of suspected rabies dogs. I can cite northern Uganda, where we had an outcry from the communities, where there was really an increase in suspected rabies dog bites, and we had to go there to investigate and also give technical backstopping. And also support Big Fix Uganda, who is a key stakeholder there, with some vaccines to do the mass vaccination. So there has been a lot of, it has really affected, and there is need for interventions if the government, maybe the Ministry of Health, which could reflect on the resources that have been allocated to fighting COVID-19, also fight some of these key diseases that don't kill instantly, but they have a lot of negative effect on the communities. How this can be improved, we need to enhance the One Health aspect of rabies control and work together to make informed decisions and also have joint interventions. And the main key weakness here is the data. If we could share the data and also have authentic data that can inform decision, that would be the best. It would really heighten the control of rabies. Then awareness, communication is very key. You asked us to talk about how awareness can be increased, how people can appreciate the risk factors and how they can protect themselves. We appreciate that communication is very key in the control of rabies like other diseases. And this is usually heightened during the World Rabies Day commemoration. But after that, we don't see really a lot of effort that has been put on communication. So it really needs to be heightened. And we are currently drafting a strategy for rabies elimination 2030. And one of the key things we are looking at is, as we know that 40% of the affected populations are children, we are targeting, working with the Ministry of Education to see that the curriculum can really capture awareness, information on rabies in primary schools. And also, like when we interacted with our colleagues from the health department, from the hospitals, they usually have outreaches, community health outreaches, but they rarely talk about rabies. So we are planning that if this could be one of the areas they could include, that rabies can be talked about during those outreaches. Then there's a risk factor of dog, irresponsible dog ownership, where someone owns a dog, but they leave it to stray, to be a stray dog. So some of those practices to be discouraged and to heighten awareness about their dangers. And this, we are proposing that there should be increased sensitization, and this we are going to do as one of the strategies to eliminate dog-mediated rabies. The way forward is that OIE has given us support in form of a consultant to develop a One Health strategic plan for rabies elimination by 2030. And we are hopeful that that plan will be ready by July. Then we can start on implementing it and following it stepwise, using the stepwise approach, rabies elimination till 2030 to be able to eliminate rabies, dog-mediated rabies. Thank you very much for listening. I'm done.
Thank you, Dr. Flavia Nakanjako, who are representing the Commissioner Animal Health, Uganda. Would like to thank you very much for that enlightening presentation, but also I take this opportunity now to welcome our second presenter, who is none other than Professor Sarah Cleveland. Professor Sarah Cleveland, are you there?
I'm here. Can you hear me, Clovis?
All right, I can hear you very well.
Excellent.
Loud and clear. Professor Sarah Cleveland is a veterinary epidemiologist at the University of Glasgow, UK. She leads an interdisciplinary One Health research program addressing zoonotic diseases, zoonotic and livestock diseases affecting humans and animal health. Her PhD focused on rabies, which continues to be one of the major areas of interest up to date. Cleveland is a member also of the US National Academy of Medicine and a fellow of the Royal Society. And I'd like to take this opportunity to invite you, Sarah, to give us an overview on what are the impacts of rabies on the poorest countries. You can put it in the context of human development as well as attaining the SDGs. Also bring out what has been done on the impact of COVID-19 on rabies control program, and how would a One Health approach help in this regard. Also focus on what are the main barriers to achieve the global goal of ending human death from dog-mediated rabies. Dr. and Professor Sarah Cleveland, you are most welcome.
Thank you so much for the introduction and the invitation to join this panel. It's fantastic to be with you all virtually in Uganda, and I wish I could be there in person. So I'm going to start to talk about impacts on the poorest community, and rabies is an indicator of poverty and health inequalities like other neglected diseases. The poor are affected for two main reasons. First, prompt access to human post-exposure vaccination is very challenging. This is because the difficulties people face in reaching clinics, because clinics in the poorest areas often suffer from vaccine shortages, and because the cost of human post-exposure prophylaxis can be prohibitive for the poorest people, costing, for example, in the order of $20 per dose in emergency situations. Secondly, it's in the same communities that people are most poorly served by veterinary services. So in these areas, dog vaccination coverage is low, the incidence of dog rabies is high. So if you're living in these areas, not only are you more likely to be bitten by a rabid dog, but when bitten, you have much less chance of getting the life-saving treatment. And while we often focus in terms of the disease burden on deaths, so in East Africa, there are around 5,500 deaths from rabies every year. Actually, a much larger number, more than 100,000 people, are bitten and exposed to rabies each year. And this itself has harrowing and enormous consequences and causes great financial hardship. And it's perhaps not surprising, given this extent of the rabies problem, that we hear on a daily basis terrible accounts of people of the experiences they face. The mother who had to choose which of her 6 children bitten by a rabid dog could go to the clinic. The father who lost his daughter to rabies because of delays in raising the funds to get to the clinics. In terms of the SDGs, some of the direct impacts are fairly obvious, but just to give one example, rabies causes economic losses of around $770 million per year in lost productivity because of premature death from people. But there are also some indirect consequences. The financial shocks that I've talked about, the need for this expenditure on PPE affects household spending on other essential needs, including other health needs and education. And we know that this often affects girls and women disproportionately. Second, we often think of rabies as a disease affecting people and dogs primarily, and it's very true that dogs are the main reservoir and source of infection for people, but rabies can also infect livestock, and this is an under-recognized problem. And when we look at the economic losses due to this, the data are quite poor, but we estimate in East Africa that about $40 million per year are lost due to livestock deaths from rabies. And just to put that in context, that's more than twice the amount of human vaccine that's estimated in projections for elimination of rabies by 2030. So we're talking about very high numbers in terms of the SDGs and economic impact. When we think about the impact of COVID, we've heard a little bit about this in the previous speaker, but there are many implications on rabies control, all areas of affected human PEP provision, mass dog vaccination, and community awareness. But it's interesting, I think, to note that actually it's dog vaccination that's been hardest hit. So we're seeing more dog rabies cases. In some countries, more human cases also reported. And this is particularly heartbreaking in countries that are coming close to elimination, such as Bhutan, where human rabies deaths are being seen for the first time in many years. But I mentioned that dog vaccination is the one that's most affected by funding cuts and staff reallocations. And I think this reflects a prevailing attitude, perhaps understandable, but actually quite hard to dislodge, that in tackling health challenges, medical treatments need to be prioritized, and a relative lack of recognition of the value of other interventions, whether that's animal health, such as vaccination, or environmental interventions, that can sometimes generate the most cost-effective outcomes. And this is essentially what's at the core of One Health. And while COVID has undoubtedly raised awareness globally about One Health, it's still far from clear whether there's a genuine commitment from policymakers to embrace interventions that extend beyond conventional medical treatments. And in the context of pandemic threats, this could hardly be more important. We cannot hope to prevent the next pandemic unless we start to think about health in the context of our interactions with other species and our interactions with the environment. But on a positive note, some of the disruptions that arise from COVID-19 also demonstrate the cost-cutting benefits of investments in rabies control for pandemic preparedness. So for example, staff that were trained and have expertise in rabies contact tracing methods have actually been deployed to develop and lead contact tracing systems for COVID. I was asked also to talk about the main barriers to the global goal of eliminating human death. And I'm going to start by flipping that question on its head. I'm going to talk about what are not barriers. Okay, then this is straightforward because we know we have the tools to eliminate the disease. We have excellent, high quality human and animal vaccines. We have a tractable animal reservoir in domestic dogs that can be effectively vaccinated. And we have a great strategy. We know that mass vaccination of dogs is a highly cost-effective way to prevent rabies deaths. And just to give some figures here on projections that have been made, if we continue in East Africa with the status quo, where investments are primarily directed at PP, we will spend around $24 million on rabies control and still suffer thousands, it's 5,500 deaths. But with investments from Gavi in improving access to human PP, combined with investments in dog vaccination, these costs can be cut to $10 million between now and 2030, with the result of less than 10 human deaths. So it's really a cut and dried situation. And I think for me, I've been perplexed for many years why we are still living with rabies. We have an excellent strategy, and we know that investing in dog vaccination can prevent these thousands of horrifying human deaths and reduce the escalating burden of PP. So what are the barriers? Well, fairly straightforwardly, funding is a particular issue, and particularly allocation of funds for dog vaccination. Veterinary services are chronically under-resourced. Investments are usually directed towards livestock and production animals. And the expertise of animal health professionals is generally in livestock health. But we also have challenges in terms of data quality and data access, particularly surveillance data, which is often weak in rabies endemic countries. But we, just as with the vaccines, we have great tools. For many years, rapid diagnostic tests, lateral flow assays, real-time genomic surveillance, these are all concepts we're very familiar now with, of course, through COVID. They've been used for quite some time for rabies surveillance, but they need to be deployed at scale, and we need to integrate that data across sectors, and we need to get those data to policymakers who are making the decision. But my final point really is a real key barrier that I've seen for years, and sadly, it's about inertia and apathy. Rabies can be consigned to history, but first we have to care enough about the terrible harrowing suffering of so many of the world's most disadvantaged people. I really hope we can all be part of making this happen. Thanks very much.
Thank you, Prof. Sarah Cleveland. This is a really touching presentation you have made, and particularly towards the end, where you are emphasizing really the impact rabies can have on the poor communities. I'd like to request you join me, appreciate and thank Sarah for this presentation, but also take the opportunity now to invite our third presenter, Dr. Cyprian. Do I pronounce it well? Cyprian Bao? Right. We are
Cyprian Biao.
Cyprian Biao, very good. Cyprian is a livestock development officer at a FAO sub-regional office for Central Africa. Dr. Cyprian is also a native of Benin and a veterinary doctor who also holds 2 master's degrees, one in tropical animal production and another on environmental science. In 1998, as a lecturer at the Veterinary School of Dakar, he was a lead expert establishing the laboratory for quality control of veterinary medicines. And from 2012, he was a coordinator of FAO livestock program in Somalia, winning a BRCN award in 2013. Cyprian also, since 2015, he has been a lead for FAO on animal disease control in Central Africa, including rabies control using a One Health approach. And this is the discussion we are centered at. May I at this point invite Cyprian to discuss with us a spice on how does FAO work with governments to tackle rabies? And how do you address cross-border issues? Secondly, would like also to hear from you that what are the different challenges that you face between urban and rural areas? With those two key insights, I would like to give the floor to Cyprian to share with us his experiences. Cyprian, you are most welcome. The floor is yours.
Thank you so much. Good afternoon to everybody. Thank you for giving this opportunity to talk about all effort that FAO is putting together in support to government, to countries to tackle the rabies issues. I think Professor Sarah have really put the situation and raised the key questions of why are we still not being able to tackle rabies and still observing death of people for due to rabies. FAO, the Food and Agriculture Organization of the United Nations, is a worldwide organization and using its position to convey the best knowledge that exists in the world and the organization to join the effort, looking at the One Health spirit to support countries. And that's why FAO have been very engaged in establishing the tripartite agreement, partnership, United Against Rabies, and develop a dedicated body that help and support country in developing their workforce, their programs to work toward the elimination of rabies. The first thing that FAO does is to use its worldwide presence within countries to support government and stakeholders to raise the awareness of the importance of rabies, but also on the available tools that can be used to tackle that disease. The second thing is that FAO uses its convening power, the strength of its governance bodies to position priority issues on top of government agendas, using like their multidisciplinary meetings, the regional conferences, or the FAO conference to actually attract the attention of decision makers on the importance of each of important priorities. And rabies has been, in 2017 in Central Africa, the focus, the priority one of government in Central Africa to request FAO support countries in Central Africa to develop their capacity and plans to be able to achieve the target of 0 by 2030. FAO also utilizes its field programs, the regular ones, but also the project. And many of you do know the ECTAT workforce and capacity in supporting countries and developing capacities for planning and mobilizing resources to fight against rabies. The organizational setup of FAO, you know, we do have country representation, but also sub-regional, regional, and global. So this kind of setup allows FAO to tackle issues at cross-border level. So when issues are beyond the capacity or beyond the management of each individual country, FAO does have the capacity of promoting same tools, same approaches to advocate cross-border and tackle some issues, and rabies is one of them. Finally, we do have program on transhumance, on mobile livestock rearing, and you know, some of them do move with dogs. And through our tracking program, we do invest in vaccination to support the programs that can help countries to overcome rabies. Now, the second question that goes about the challenges that we face between urban and rural area is a very important one. Rural area presence, you know, is quite difficult to be sustained while government and technical institutions are themselves not really present at rural level. However, there are solutions of partnership, identifying existing bodies, health facilities and personnel, and civil society to raise awareness and train people to use the tools that are available. We also use a lot of communication, especially when we're talking about these important diseases. And you know that in rural area, communication is a challenge. It's a very important challenge. So we use our presence in the field and some field mission to raise awareness and to discuss with local authorities and available civil society to develop this program. FAO also have a very important program on establishing community animal health workers. Those people, if they are well trained, are some relay for us to reach targets far where we do not have institutionalized bodies of the government to tackle within rural area. While talking about the challenges we face in rural area, we should not forget that even within cities, we have even more challenges because of the high population of dogs and homeless dogs. And this high population and lack of collaboration between different technical bodies within the government and institutions make it sometimes difficult to come together and have the same program to tackle rabies. So in FAO, what we do is actually to convey the platform to discuss using the One Health approach to understand. And as I'm talking to you, starting from tomorrow, the Central Republic of Africa is starting a workshop that will last for 2 weeks, where experts, but also civil society and different stakeholders will convey every day to understand how they can go about planning the elimination of rabies and put the Central Republic of Africa in the road for zero by 2030. Thank you very much.
Thank you, Cyprian. And I think that has been very, very elaborate. You've given us a full insight into FAO work with regard to rabies control, but also the challenges faced in the urban and rural areas. I would like to thank you very much for this discussion, but also at this point, invite our third speaker before we get to the question and answer session, Dr. Alsaida King. Are you around?
Good morning, Dr. Kankia, yes.
Yes, you're most welcome. All right, I would like to take this opportunity to introduce you to the audience that Dr. Alsaida King is the Director of International Veterinary Health, MSD Animal Health. He is qualified as a veterinary surgeon from Glasgow University in 1990. After 11 years in mixed practice, he joined Intervet UK as a livestock veterinary advisor. In 2012, he joined MSD Animal Health, and in 2014, he was appointed the Director of Intergovernmental Veterinary Health. He has developed a number of communication tools, both on general transboundary diseases such as emergency newsletter and website. He works with a number of governments and organizations on rabies control plans and strategies with a focus on vaccine accessibility and education. I take this opportunity to invite Dr. King on the discussion that what impact has COVID-19 had on rabies vaccination of dogs worldwide? Secondly, what are the challenges in ensuring supplies for effective canine rabies vaccines are provided? Thirdly, would like to hear from you on what do you think could be done on governments, private sector, and other stakeholders, including civil societies, with regard to the discussion at hand. Ladies and gentlemen, allow me invite Dr. Alcider King to give us his talk. You're most welcome.
Thank you, Dr. Kankia, and thank you everyone for joining and listening to what is a really important topic. How do we eliminate human rabies? This isn't a disease that we should still be talking about and having to deal with. So having everyone listening is really important. And I think we've already heard from the other speakers some common themes arising out of the thoughts. We can start to see some of those areas that need addressing. The first question I was asked was, what impact has COVID-19 had on rabies vaccination of dogs worldwide? And Sarah's touched on that. The harsh reality is that it has undone much of the work that was already being done and the successes that were already being done. It's slightly ironic. Because of COVID-19, the world is more aware of One Health and One Health diseases and how these things happen, which is fantastic because rabies really is the prime example of a One Health disease. But at the same time as that increased awareness, all of the funding is now going into COVID. But not only the money, it's the time and the effort and the other resources that are being diverted into COVID-19. It is, of course, very important we get COVID-19 under control. There's no question on that. But if we forget about everything else that's going on, we're going to see other problems arising. And what has been clear over the last 18 months is a reduction in dog vaccination. The amount of vaccines that are being purchased, the way they're being used, how they're actually being deployed, all of these things have reduced. So we can see, as Sarah said, this impact where we're already starting to see an increase in rabies. And that's just the start of a wave that's going to come. So we need to be aware of that. What then are the challenges in ensuring supply of effective canine rabies vaccines? It would be very easy to say it was just money. Actually, canine rabies vaccines are cheap. They're not the expensive part of any rabies control program or anything like that. And using dog vaccines is a lot cheaper than using human vaccines. So if we eradicate the disease, then we're going to be saving a lot of money. That isn't really the issue, money at hand. What are the issues? Poor quality vaccines. Those are certainly being used in a number of places. And at the least that poor quality vaccines do is not control the disease so that animals that seem to be vaccinated actually aren't protected. At worst, potentially they can bring in other diseases if they've not been produced properly and not inactivated. So we need to be aware of that. But also, what's really important with poor quality vaccines is it undermines people's faith in vaccination. Not just for rabies, but for everything that we're trying to do. There's so many diseases we're trying to stop and try and improve health around the world. If people don't believe in vaccines, that's not going to happen. And if people have their dogs vaccinated and then they still get disease, they turn around and say, well, vaccines don't work. So why should I have a vaccine against COVID? Why should I get my cows vaccinated against foot and mouth disease? Why should I? It undermines everything. So it's really important that we don't use poor quality vaccines. And then planning and logistics is really important. People sometimes ask, as manufacturers, what is our capacity to produce vaccine? And that's the wrong question. It's how much vaccine do you need? Because if you tell me what you need, we can produce it, but I can't produce it tomorrow. To really get our capacity up to good levels, it's going to take us 12, 18, even 18 months, even 2 years, because of the way that things happen. If we're not being told what's required, we can't produce to it. So better communication, planning, and logistics is really what will help with delivery of effective canine rabies vaccines. And that means talking to each other, which really comes on to that third question you asked, Dr. Kankia, of what more could be done by governments, private sector, and other stakeholders. Communicate, talk. Let's sit down and understand what the real needs are, what are the demands. Better planning, open discussion, massive improvement in surveillance and awareness. That's one area. We keep talking about the number of deaths to rabies. We're underestimating that because there's not good enough surveillance. We don't understand what this disease is really doing. People talk about hotspots, and it's important to know where the hotspots are. If you've listened to my podcast or anything else, you're going to know what I'm going to say next is actually what we need to worry about is the cold spots. It's where we don't know the disease is, but it's happening. We're not getting the reports. That's the real crux of getting to understanding what's happening with this disease. So we need to improve that surveillance. And then we need to improve human education and understanding on rabies, getting the public to understand not only the disease, but how to live with dogs in harmony. When we work on that, we cut down on dog bites. And if we cut down on dog bites, whether they've got rabies or not, if we cut down on dog bites, we need less PEP because you don't have to treat people if they're not bitten. So that saves money. It's a brilliant step forward and it's really good. Educate people and sit down and talk to them about why this is important and make this life with dogs a harmonious one where we benefit from living together, which is what we're supposed to do. If you go back a long, long time ago, this is why humans and dogs got involved together, because actually we can live in a very helpful way and actually help each other. And then sharing knowledge and learnings, looking at what has been done and understanding what works and what doesn't in control programs. You know, a few years ago, we did a project where we looked at using text messaging to reach out to people during vaccination campaigns. We did that in Haiti. It was really successful. We almost doubled the number of people who came bringing their dogs for vaccination. Well, that kind of thing needs to be talked about, and we need to sit down and learn from that so we understand better how to get people to get their dogs vaccinated. I think a lot of those themes have already been covered. I really appreciate the chance just to maybe hammer some of those home a little bit. So thank you very much, Dr. Kankia. I will hand back over.
Thank you, Dr. Al-Saida King. I think to me now you have put us on the ground to start talking. Having heard from Dr. King's presentation, I think we now move to the point of question and answer. We have had 3 presenters. They have made their presentations, and I'd like now to take some questions to the audience, from the audience to the presenters, so that we can discuss in the next 5 minutes or so before we move on to the other presenters. Thank you. So the next step are questions from the audience. Questions to the 3 presenters are most welcome. Direct your question, and then you can take note and give a chance for the presenters to respond.
Dr. Clovis, I think you'll find that the questions are in the question box and people have to type those in. There are 2 questions there if we look at the chat box. So maybe you could read those out for the audience.
The first question there is from Katie Cronium, that what has been the impact of the COVID-19 pandemic on rabies control efforts? I understand there has been increased rabies outbreaks because dog vaccination has been suspended or canceled in many countries. And the other question also from the same person, Katie, that a question for FAO: are community animal health workers being trained to vaccinate dogs? And what are the barriers to increasing dog vaccination on the ground? So those are the 2 questions that we have. would like to hear from the presenters, particularly those touched by the 2 questions, as we wait to receive more. Is the first one directed to Sarah Cleveland?
Yes,
Yes.
I can address that to some extent, and perhaps just report back some results from a survey that was carried out recently involving people from a large number of countries, 47 different countries, about the different types of impacts of COVID-19. And they really did span a wide range of different types of disruption. But it was dog vaccination that was the hardest hit. But issues around reduced funding, we heard from the situation in Uganda around movement restrictions. And it wasn't just people not being able to move, people were actually more worried about moving around in some areas because of things like hijackings and increased sort of lawlessness in some areas in terms of going out and about. Problems about staff redeployment, which is kind of this double-edged sword, that it's a good way to demonstrate that investments in rabies help to build capacity that can be deployed in health crises. But of course, you need to try and build enough capacity that you can keep those essential activities going to prevent these fatal diseases at the same time as managing health crises. Challenges with supply chains, and we heard from Alistair about it's not just a question of resources, it's a question of the logistics and setting up effective supply chains. And this is going to be a central part of core capacities across the board, not just for rabies, just not just for COVID. This is really a good time for us to be thinking about getting smoothly operating supply chains and reliable supplies of high quality vaccines to where they're needed. But yes, dog vaccination, absolutely the hardest hit, and we will see the repercussions of that, and it's set back the advances made in many countries. And it's really heartbreaking to see that the efforts, the commitment of people actually to pretty much get to the point of eliminating human deaths, and a lot of that being undermined now. So yes, it's a challenging time for everybody.
Yeah, sure. Yes, thank you, Sarah. Cyprian, there was another question targeting FAO.
Yes, thank you, sir. For real, so far in the vaccination programs that we are having, or the project we are having, no, we have not been actually using community animal health workers to vaccinate dogs. However, community animal health workers have participated in many disease control and eradication programs, and they prove to be quite efficient if they are trained. So this constitutes for us some level of workforce that can be mobilized, especially when you're going toward the end, because the number of dogs to be vaccinated increases drastically. And as you may know, veterinarians are not as many as we could expect. So these are grounds where we can pull a number of technical competencies, train them, and use them to do vaccination campaign. Now, one of the issues we encounter in the field while running vaccination is the misinformation. You know, some rumors about sometimes they simply say that if you vaccinate your dog, it will die. And that's enough to really put down a whole campaign. So before starting the vaccination campaign, communication, information, interaction with communities is very important. It is very important that you put people and build some confidence on what you want to do and what you want to achieve. Some resources, let's say, you know, it's all about financial resources. That's one of the limitations to implement large mass vaccination programs. You know, in many countries, resources are very limited. They have to make priority. They need to be supported to mobilize resources and get these vaccines. Once we can have access to vaccine, the second part of it is the logistic to deploy the vaccine within the countries. And in many countries in Africa, logistics for cold chain and people that are trained is not that easy. So these are things that we work on to develop capacity, but also support government to mobilize the resources.
Thank you. Thank you very much, Dr. Cyprian. And I'd like to share with you that in Uganda, it's only in the Karamoja region, the northeastern part, where we tap into community animal health workers to help us in all these kind of, disease prevention and treatment programs. In other areas, we have to have either para-veterinarians or veterinarians together. But as you mentioned, they are very thin on ground. And community animal health workers can play a huge role, not only in the vaccination programs, but also in mobilizing the communities for a number of programs such as vaccinations. Yes, so I think with that, we are moving on well. Are there some more questions? I don't know. We need to check in the chat.
Dr. Kankyo, do you mind if I just follow up on that about paraprofessionals?
All right.
Paraprofessionals are really important. And one of the key areas is because of the way they work with the community and they're trusted with the community. These community animal health workers are people that everyone knows. Now, if I go into one of your villages in Uganda or Kenya or something, I'm just someone walking in from Europe or the US who doesn't understand the challenges and what's going on. Why would someone listen to me? I don't have the credibility. So I walk in, I speak, I can talk all the science and I can understand everything that's going on. But once I walk out of that village, everyone's just going to, well, who was that guy? We don't know who he was. Mm. If your local community animal health workers and the paraprofessionals are there saying, okay, this is what we need to do, and this is how we make a difference, that's where we will make that real difference on the ground. So I think it is a really important area. And rather than thinking about barriers of not having people, actually, we've got some really good people on the ground. We just need to use them well.
That's correct. Thank you. Social capital. Community health workers are trusted. So I think you have brought it very, very well because they work with the communities and they are close to communities. And I think with that, let me check. There's another question, 201, from Joel. We understand Gavi pledged to assist on PEP from 2021, unless this data has changed. Now, with all the resources directed to COVID-19, can East African countries, which all are Gavi members, set different timelines for this investment? Right, so I think this goes to Dr. King again.
Well, that one isn't to me really, because Gavi is human vaccines and I'm dog vaccines. So I'm not sure on what the Gavi situation is with that. I would need to pass on to, I don't know whether either of the Sarahs might know, I don't know.
All right, so I think we move on to, yes?
I'm afraid I might have disturbed a question about human PEP from Dr. Adesola. I was just saying, answered it in the chat, and it seems to have disappeared a bit from the open question, but I don't know whether there's time to hear or whether this will come at the end. I can also have some answer in terms of the question around alternative strategies for dog vaccination, but I think there's probably not time just now.
Yeah, maybe later. Let's see. Let's move on because of the interest of time. Let's move to our next presenter. And then we'll get back to perhaps capture some of these aspects or responses. May I at this point invite Dr. Sumbi Mwangi. Dr. Sumbi Mwangi is the director of Rabies Free Kenya, Washington State University. Dr. Sumi Mwangi is an associate professor at Washington State University with joint appointments at universities of Nairobi and Edinburgh. He's based in East Africa, and his research is on transmission and control of zoonotic diseases, including the science of rabies elimination, use of data to improve speed and quality decision-making in health. May I take the opportunity to invite Dr. Sumi Mwangi, who will discuss with us a number of aspects with regard to understand we are working with partners and technical experts across the world to build a picture of most effective tool for surveillance and response on rabies. Can you outline on some of the interesting new tools? Further, I would like to hear what further support do countries need to create effective national plans for rabies elimination? Dr. Sumi, the floor is yours.
Many thanks, Dr. Kankia, and good afternoon, good morning, everyone, depending on where you are. I'll start by saying we are in 2021. We have 9 years to end deaths due to human rabies. That said, if you look at the global strategic plan for rabies elimination, it takes that the year between 2021, 2025, and 2026 is when we should be doing all the mass dog vaccinations to eliminate dog rabies. And then the years between 2026 to 2030 would actually be mop-up years. So we are almost running out of time for action. That in essence, we should be working really hard to make this target happen. So one of the key questions that we have tried to answer is, what are these catalysts that we need as countries that are endemic for rabies that can enhance our ability to make this target a reality? I think some of the issues that have been raised by Dr. King, Professor Sarah Cleveland, regarding like vaccines, dog vaccines, and the quality of vaccines. I think at a global level, there are already really good solutions out there. So we have, for instance, what they refer to as the OIE vaccine bank, which is a big attempt to minimize this ability of countries or make sure that countries can get the appropriate vaccines that are highly effective. That would need to take advantage of. I think the other second one is what my colleague Joel Changalusha from Tanzania was referring to, the access to human PEP under the Gavi provision, which is really critical because all the information we have got from rabies endemic countries is that a lot of human deaths happen because people do not also access post-exposure prophylaxis promptly, which means those are preventable deaths. We prevent the deaths in animals and make sure they cannot be transmitted to humans. But in the event, before we can eliminate the disease, that people get bitten by potentially risky rabid animals, that they should access these vaccines to save their lives. I think that's an important other global tool that's available for us. And hopefully that countries like the ones in East Africa will have to enjoy that, or at least take advantage of that. To answer your question regarding what are these exciting new tools that are coming, I think, first of all, the comment I'd like to make is that we already have got excellent tools that have been used elsewhere with success. So we know there are countries that have managed to eliminate rabies so far with some older tools. What you're looking for are these catalysts, the things that can help the countries that are endemic at least reach that goal faster. So one of the key issues is around how do you do your surveillance? What are the minimum data elements that are required so as you don't end up collecting unnecessary data or you don't end up not collecting really important data? So under the working group of the United Against Rabies Forum that's concerned with this, we are working towards having a minimum data elements that can be shared with countries that are endemic of rabies, and that they can use to make sure that they collect sufficient amounts of data that can support the elimination programs for them. And that could be on dog detection, it's on integrated bite case management, what you might require for PP and the supply of dog vaccines. So that tool will be available for these countries in the coming days. The second really critical thing that we're working on is on tool evaluation. Now, I have been working on rabies for a number of years now. And when COVID arrived in my own country in Kenya, we were called upon to help the country respond. And our very initial discussions and difficulties in dealing with the pandemic was around which tools to use for contact tracing, which tools to use for collecting data. And I'm sure that's an experience that has been experienced in many of our countries in Africa and Asia. And the truth is, along the way, we went with very old tools because we could not make a decision quickly as to which are the appropriate tools that could be adopted. I think one of the key issues to also really sort out for rabies elimination is an ability for countries that are endemic, that have rabies, to be able to make a choice as to which are the appropriate tools and what are they able to do. So one of the key issues that we have dealt with is this tool evaluation, which is coming up with a way in which you can evaluate all the new tools on data collection that show up within countries, that countries have a list of things, or at least have information that can help them make that decision quick. Because the delay in dealing with like 5 or 7, 8 different tools can be very expensive. And I think if you have worked in the veterinary world, that's also one of the biggest issues around surveillance for animal health diseases generally. Like in my own country, I would say that we have had maybe 7, 8, 9 generations of tools. So I think it's really critical for us to identify which are these tools that can work best. And part of what you're doing is providing that one good evaluation tool that can help countries make that decision pretty quickly. The third thing is, to eliminate a disease, you do need everyone to really come together. You need the professionals, the veterinarians, and public health specialists and healthcare workers, but also you do need the community to be part of it. And one of the other tools really is this rabies mapping activities, so as you do not have duplication of efforts. So we are creating a map that can help identify, if you go to Uganda, who is working on rabies, what are they doing? Is it possible to bring them together so as they can bring their efforts together and make sure that they can achieve the goal much faster? So that's just some of the key tools that are really important, not in themselves that they can make, can eliminate rabies, but they can be these catalysts that we require within the rabies endemic regions to achieve that. I think the other question you asked me was, what are these further support that countries like my own require to make 2030 a reality? I go back to some of the issues that have been raised by my fellow panelists here. So one of which is determining how many vaccines you require, where you require them. A demand forecasting, supply, and logistics question. It might seem like it's not a big issue, but if you look at what has happened with our colleagues from, like expanded program of immunization, one of the successes for that has been this really good forecasting system that how many children are born, how many children are going to require measles vaccines in the next 6 months, and they can use that to make sure that we provide, this expanded program of immunization vaccines pretty well. Now, in the animal health sector, where we need like dog rabies vaccines, we don't have an excellent system. And I think that's really a call for FAO and for OIE to look into that, because I think a proper demand forecasting supply system for veterinary vaccines within our continent is really important to support not just rabies, but also these other important animal health infections. I think the other thing to mention is we for instance, know that Gavi has made a commitment. They would like to make an investment on rabies PEP. but they're important prerequisites. For instance, it's clear we cannot just keep vaccinating people without vaccinating dogs, because that's an unending vaccination. And the way to eliminate rabies is to make sure you can vaccinate dogs, but also provide PPE promptly. So even though ministries of health are able to provide sometimes PPE monies, there seems to be a disconnect between their investment on the human side and the investment being made on the animal side. I think what countries require is a way of supporting that the budgets of the Ministry of Health and the budgets of the Ministry of Agriculture and Livestock are somehow talking to each other, because an investment on the animal side from the health side actually prevent or at least minimize the amount of money that the health side requires. That, I think, at a global level and at national level really must be talked about and must be supported. And last point I want to make around this is that we have budgets even within countries that are endemic for rabies, and these budgets are not always like what you're looking for as a solution for rabies elimination. We want to advocate for domestic ownership, and that our own budgets also do provide monies towards rabies elimination, both at the human health side, but also at the animal health side. And in our experience here, these kind of statements that I've just made are good statements, but the actual practical way of making sure that dog rabies is funded next year is to be involved in the budgeting of a country or budgeting of a region this year. So governments make budgets every year. We have to invest for next year. We have to invest in that budgeting process this year. Otherwise, next year we'll say government also needs to make some investment within rabies. Those are my comments, my fellow colleagues, and I hope we can have these discussions further. Thank you.
Thank you very much, Dr. Sumbi. This has been a very good, detailed discussion with regard to how effective national plans, strategies for rabies elimination coming 2030 to zero. And you reminded us that we are only left with 9 or less years towards that target. So where are we in that direction? And it's very, very important that we focus on practical aspects, including One Health kind of vaccination, where we don't focus on the Ministry of Health only, but also have a concerted effort where there is working together with the Ministry of Agriculture, Animal and Fisheries, as well as Ministry of Health. I think to me, this is very, very good insights into the discussions upcoming. Thank you very much. And I'd like to take this opportunity now to introduce Professor Emeritus, Professor Lord Trees. I hope I pronounced it correctly. Professor, are you there?
Indeed, I am. You may have a different name. I am not Katrina Prince, but I'm Sandy Trees, but I'm here.
Thank you. Happy to see you and happy to be with us today. Professor Lord Trees is the veterinary surgeon and a crossbench peer in the House of Lords. He was a professor of veterinary parasitology at Liverpool School of Tropical Medicine. In 2021, he was appointed the chair of the steering committee of the United Against Rabies Forum. I'd like to welcome Professor Lord for the discussion, focusing on how can tackling rabies support countries to develop an effective One Health approach to other infectious diseases. Secondly, I would like to hear from you on what are the plans for the United Against Rabies Forum and how will this support countries to deliver the target of eliminating deaths from dog-mediated rabies by the year 2030. Professor, the floor is yours.
Thank you very much, Dr. Kanke, and good day, everybody, and thank you very much to the organizers for inviting me to speak at this conference and in this session. Of course, I appreciate the whole summit is concentrating particularly on COVID-19, and that's absolutely appropriate. But it is very appropriate as well that we do consider another major zoonotic disease, one of the oldest known in humans, that of rabies. And for two reasons, really. Human rabies can be controlled very effectively with a cheap vaccination of dogs, the source of virtually all human rabies. But secondly, and importantly, rabies provides a terrific, I think, exemplar of how a One Health approach can provide solutions to other zoonotic human diseases. Now, the audience, our audience is well aware of the concept of One Health, the understanding and appreciation and recognition of the interconnection between human, animal, and indeed environmental health. And COVID has certainly brought One Health to the fore, as many speakers have referred today. We know that virtually all emerging infections in humans originate from animals. Some may cause pandemics, like the SARS-CoV-2 virus, but others cause persisting endemic human health problems like rabies. But what they share is that responsibility to prevent and control them falls between different organizations in a policy and governmental context. All governments throughout the world divide the responsibilities and the budgets into silos, which we call ministries or departments. But when we're faced with One Health challenges, it's important to build bridges between those policy and budgetary silos to most effectively and economically address the challenges. We'll not successfully tackle rabies or any other zoonotic disease without an effective One Health approach. And that means working together, fostering collaboration between medical, veterinary, and environmental authorities and scientists. Whilst in Africa, I'm well aware there are very strong veterinary departments, their focus is often, understandably, on livestock. But the surveillance and control of zoonoses may go beyond livestock and involve, as we've heard already, companion animals and indeed wildlife. And rabies is a good example of that. So rabies is a good platform, I think, for building One Health systems. Because we have all the elements of an effective strategy. We have rabies vaccines for humans and for dogs, as we've heard, and they've been around a long time, and they're very effective. In fact, rabies, of course, was one of the first vaccines ever made. We also know what is required in policy terms. We need national and local government leadership, that's critical, but we also essentially need community involvement and engagement. We also know pretty accurately what it will cost, and it is not prohibitive. It is well within reasonable financial targets. The challenge is implementation, especially in low resource settings. It requires leadership and political commitment to provide access to PEP, post-exposure vaccination, vaccinating all dogs and engaging communities. And importantly, to achieve global control, it needs a coherent international support system, which we'll talk about in a moment. And that will save not only tens of thousands of horrible human deaths from rabies, but a One Health approach can also contribute to dealing with the next pandemic. And Professor Sarah Cleveland has given a good example earlier of how rabies control staff have been able to work on contact tracing, for example, during the COVID-19 outbreak. So we have all the technical tools we need to tackle rabies. And by tackling rabies, we shall be building effective One Health systems that have benefits well beyond the elimination of a single disease. So the second question I was asked, well, what are the plans for the United Against Rabies Forum? And I have the honor of chairing the steering group for the forum. And how will this support countries to deliver the target of eliminating death from dog-mediated rabies by 2030? Now, the overarching purpose of the United Against Forum is to provide a mechanism to implement the objectives that were laid out in the Rabies Strategy 0 by 30 produced by the tripartite of the WHO, FAO, and the OIE. By bringing together an inclusive network of state and non-state actors who share a vision for rabies elimination. We are working with governments to identify the main constraints that prevent countries from progressing towards elimination, and in order thus to propose solutions that help countries in overcoming these problems. UAR partners are actively progressing priority areas which were defined by the wider rabies community during the inaugural stakeholder event in 2020. We have three main groups of experts that have been put together. The first group are focusing on helping countries to effectively use vaccines, medicines, tools, and technologies. I call them in short the tools group. Some of the key activities that are underway include, and Dr. Mwangi has alluded to this, identifying minimum data, for example, to help countries strengthen surveillance systems, and evaluating existing tools to provide guidance to countries on how to select and adapt these for national control programs. This group also plans to map existing rabies activities to facilitate coordination and assist stakeholders in assessing progress and identifying gaps. A second group is focused on building One Health approaches and capacity and promoting integrated country and regional strategies, the operational group. This group has already developed a national strategic plan, a template to help countries develop their own country-tailored framework, and it's an excellent document, and I look forward to being rolled out and adopted. And it's also produced a roadmap that provides guidance and resources to countries as they progress towards elimination of dog-mediated rabies. The OIE has already developed a system for endorsing countries as they submit their own rabies control programs, and that paves the way for members to self-declare freedom from dog-mediated rabies. And a third group is considering potential financing facilities to fund the global objectives. An important next step for the forum is exploring opportunities for rabies to be integrated with other disease prevention and control systems. That's very much a theme that WHO have adopted in terms of approaching health system strengthening as opposed to individual disease control programs. And particularly, we want to look at the NTD roadmap developed by WHO and to see where synergies can be found between the different NTDs. For some years now, various ministries of health, NGOs and charities have been delivering rabies control, doing a great job in some of the 67 or so countries where rabies is endemic, and in which it's estimated over 1 million people may be at risk of dying between now and 2035. Between these efforts and the tripartite commitment to 0 by 30, and all the good work being done and already done by the experts and stakeholders in the UAR forum, together with the pledge by Gavi, which we've heard about, to donate human PEP vaccines to eligible countries, it is now time to bring all these efforts together in a united, coherent and global drive to eliminate dog-mediated rabies by 2030. It is an ambitious task, but we have the tools to do it. Rabies is an historic disease, but it's completely preventable. So let's make rabies history. Thank you.
Thank you very much, Professor Lotris. I think the last aspect you have made is very, very key. Let us make rabies history. And that's the whole focus, why we are here to discuss and echo our concerns, share our experiences, as well as, network to make sure that we find measures, sustainable measures, using a One Health approach on how we can make rabies history. Thank you very much for that talk. And I think to me, it's a very, very forward-looking as well as, you know, an overarching discussion. So, ladies and gentlemen, join me to thank Professor Lotris, but also now having heard from the professor as well as Dr. Thumbi, we can now have some few minutes, 10 to 15 for questions. I welcome questions. This is a question session now. Clarifications, and perhaps you are free to ask even the presentations that were made from Flavia, Sarah Cleveland, Cyprian, as well as the two previous presenters. So feel free. The chat room is open, but also you are free to ask online.
Perhaps while we're waiting for any further questions to come in, I could address a part of the question from Katie Hampson.
That's right.
Around the Gavi opportunity. Just to emphasize what an extraordinary opportunity this is for us working on rabies. It really puts rabies on the map in terms of global health priorities, the fact that Gavi have indicated a commitment in investing in rabies. And we really have to grab this opportunity with both hands. It can represent a huge potential saving to public health departments in terms of their budgets on PP. But the key element is that as Dr. Thumbi said, is there must be demonstration of a commitment to scaling up dog vaccination in parallel. And in order to make the applications to Gavi, these have to come from governments. So governments have to rise up to this challenge to put in the applications. There's a lot of expertise out there. I think international organizations can help with this, but there is in the rabies community a lot of expertise. So it'd be great if this could be harnessed in developing strong applications to Gavi so that these investments and these commitments can be realized. It'd be such a shame and a lost opportunity for us if we let this slip now.
Thank you, Prof. Sarah Cleveland, for that clarification on the Gavi question. There was Anne also said, I would be interested in the same question that Katie Hampson has asked. Thank you. So I think you have
there may be, I'd like to allow others to have an opportunity to address that. There'll be different perspectives. So that was just my own view on it.
Sure, that was your view. Yes. Are there some other responses from, yes.
Yes.
Dr. Thumbi.
I should make a quick comment about this. So I think at a global level, we say Gavi is going to make an investment. At a local level, people have you have sort of get leadership within countries to pursue that. So one of the key issues, I think, like for PEP provision, is that most countries within at least Africa use intramuscular injection to deliver PEP. Part of the WHO recommendations of 2018 is that countries should be moving into the dose pairing much more cost-effective intradermal. So the way you change the delivery of vaccines at a country level, there will be task forces or committees that have to review that evidence and make that recommendation so as the country can move into that direction. Now, in the absence of people, who are involved in rabies, taking those recommendations to them and saying we should pursue this, they have a lot of other infections to worry about. There will be a cholera one, there will be COVID-19 vaccination. So there has to be a push even within our own countries to make sure that we are starting to prepare for this Gavi investment.
That's a good one. Yeah, thank you for that, sharing that example on the kind of insights to how.
Dr. Kanke, could I just make a comment, or perhaps ask a question?
Please do.
Which is perhaps a bit controversial, but I think in this forum we should be considering it, and perhaps I could direct it to my good friend Sarah Cleveland. But is there an element of conditionality in this Gavi pledge? In other words, we, from the point of view of vaccinating dogs, do need to be making progress and committing to that and pushing that forward to take full advantage of the Gavi pledge, put it that way. I mean, to what extent is there some conditionality that there will be significant efforts and progress in dog vaccination in order for this pledge to be fully realised and continued? Could I ask perhaps Sarah or anyone else to address?
I'm probably not the best person to answer that, but I think my understanding is that there is clear conditionality around that. It's the expectation, because otherwise this is an unending financial commitment and the costs are going to continue to escalate. The extent and degree and the details of that, I am not familiar with. The others on the panel may be, but certainly Gavi will be much more likely to invest in PEP provision if there's a concomitant commitment of the country to support and scale up mass dog vaccination. And the projections and the data are so clear on this, that's where we're going to get the real win-wins. We're going to ultimately save more money in the long term. We're going to save human lives, and we're going to be able to eliminate deaths from rabies, which we can't do any other way. So there's a very tight coupling of the two things, but the exact details and the degree of that, I'm not clear of those details.
Okay, thank you. Is there any other clarification or input in that line? Are we still with Flavia? Maria, are you there?
Yes, please.
Yes, do we have any aspects of Gavi in Uganda? How's the progress? You are the coordinator for the Rabies program. How is it handled at the Ministry of Agriculture and Industrial Fisheries with regard to, accessing this Gavi PEP support?
I'm not yet aware about that program of accessing it.
Okay.
From Gavi, but all I know is that health facilities are able to get people from the national medical.
You're breaking the national medical stores.
Medical stores at subsidized price. Yes.
Hello, we can hear you.
Yes, that's what I said. I'm not so sure about the Gavi program. Maybe I'll inquire from my counterparts from the Ministry of Health. Yes, but national medical stores usually give supplies to health centers at a subsidized price. Yes.
Okay. Right. Any other? There are a number of questions in the chat room. Allow me to check and share with you briefly. We have, right, Joel also said that, can we also expect from other international communities on coping? Can we also expect from other international communities on coping the Gavi move on dog vaccine? Should we expect possibly FAO thinking of supporting on dog vaccines for low-income countries in Africa and Asia instead of intervening on outbreak only? What should endemic countries do to trigger international communities think of investing on dog vaccine for large scale outside the OIE vaccine bank? There is, I think, take note of that, my presenters. There is another question from Dr. Samuel Okech, panelist, that do you share the same feeling I have that there is need to have a webinar dedicated to understanding the application of One Health concept in rabies control. Could we have a forum to listen to and assess models that have so far been used in various places with a view of designing effective One Health models for rabies control? Would this be a good output for this discussion? Or perhaps all is well with all countries? That's the other question from Samuel, and you also got the other one from Joel. So panelists, this is stable to us. Feel free to interject in and stop me. You can give in your thoughts with regard to the two questions that have been shared with us in the chat room.
I could begin by trying to answer part of what Samuel is asking. I think it's a really good question. So we have got a number of organizations at the African level that are interested in this One Health concept. So I know, for instance, the Africa CDC produced a One Health document not too long ago. I'm aware that the East African community is working on a similar thing. And for some reason, if you look at what are the priority zoonotic diseases in many of these countries, rabies does rank quite highly. So I think in terms of concept on paper, One Health is accepted and rabies is seen as an important One Health disease. I think the real question is, how do you operationalize these concepts and make them work? So part of what you're trying to do at the moment with countries within East Africa is to bring ourselves together onto the table and talk. What is required for us to increase mass dog vaccination? What are the lessons we can learn from Uganda? What are the lessons we can learn from Rwanda and Tanzania? And perhaps by combining these kind of experiences, we might be able to come up with a way of encouraging our own countries and working with our own countries to implement this One Health concept. I think that what you're asking for, which is a webinar, is an important thing. And there are opportunities, I think, to discuss this more and eventually come up with something that is that will be practical and usable within our continent. So I'll make an invitation to you, Samuel Okech, to the meetings that we have been having, and hopefully we can get a lot of input from your end as well. Thank you.
Thank you, Dr. Thombe. And the question straight to you, that tell us on how regional rabies control is progressing in East Africa.
So, if I were to be honest with you, I would say COVID-19 has taught us that once you sort of face the crisis, you go back to your own country and sort of try and deal with it. And only after you realize that you can't deal with it as a single country do you start looking for ways like COVAX, which sort of allows more vaccines to get to the world. It's a similar thing with rabies. I think Kenya developed a nice strategic plan that has been implemented for about 4 or 5 years. Tanzania is also there. We have countries like Rwanda that are developing it right now. So the progress is that we are at different stages, but we are brothers and sisters, and we have sort of bring each other together and make sure that we can make it work for the region. So that's why we are at different stages, but working towards one common goal of rabies-free East Africa by 2030.
That's good. Thank you. The next question is to Professor Lord Trees. We know that we need to have a public health expert working with animal health. This is a regional World Health Summit. How can we convince public health colleagues to get more involved with supporting rabies elimination? Professor Lord Trees.
Thank you. It's a very good question. It's rather a difficult one. I mean, I think we have a lot of vets, I think, and animal scientists on this conference. And whilst veterinarians recognize the value of One Health approaches, we constantly acknowledge the challenge of getting medically qualified people engaged fully in that debate. I think we need to reach out as much as we can. we are fortunate to have, well, in the UK, for example, institutes of tropical medicine, where there's a lot of infectious disease knowledge and capability. And there is a good understanding amongst medically qualified public health people about the interrelationship of infections in humans and animals. But I think this is one of the things that COVID will have some good outcomes, and one of them is the recognition of engaging human public health people in discussions of threats from infections in both domestic and wild animals. And we have indeed, our Prime Minister in the UK has several times referred to One Health in some of his major speeches to various international senior governmental groups. So I think the situation is changing and improving, but it is a major challenge, I have to acknowledge, to engage public health people. And obviously those concerned with human health, their budgets, particularly obviously in low and middle income countries, the budgets are very constrained, and they have huge human only problems to deal with. And it's difficult, of course, in that context to persuade people to devote some of their budget to, for example, vaccinating dogs or to help vaccinate dogs. Although that would be the way to save costs in terms of human lives and costs, financial costs associated with PEP, for example, which has been mentioned. But it is a difficulty and a challenge, and I don't have an obvious solution.
Yeah. Thank you very much. Sarah's hand is up. Sarah Cleveland.
Sorry, I don't know how we're doing the timing, but earlier on, Dr. Adesola posted a question in the chat exactly around this, about that often the focus is on animals without giving really a clear opportunity to discuss the human perspective. And I just wondered whether we might be able to hear from Dr. Adesola at all. I don't know if there's a way to hear, but I don't know whether he can post more information in the chat, but just to say that there is a request for more discussion on the human perspective.
Yes, could you hear from Professor Dr. King? Because we are wrapping up, we are running out of time now.
I think most of it has been covered. I'm not sure there's much else I can add. Okay. It's important to have this conversation, and it's been, I think, very valuable to talk and share these things. It is a One Health approach. It's how do we engage both sides and get both sides talking properly. And that has always been a big challenge. Although it is a massive One Health disease, if you look on the human health side, it's seen as being a dog problem. If you look on the veterinary health side, they say, well, we're trying to stop human deaths. So who pays? And it comes down to an argument of both sides saying they're not going to. Looking at that human impact, how they're involved, what we can do, needs vision from people in order to bring it together properly. And that's been a lot of what we've heard today.
Thank you. Thank you, Dr. Sada King, for that. And I like that because I come also from the multifaceted or blended perspective. I'm a veterinarian by first degree, but I've had other degrees in social science as well as public health. So when you're talking about talking to people, understanding the perspectives of the people, their feelings, can either break or make the vaccination program. So I'm really glad to hear that people perspective integrated within the science of what we are discussing with regard to elimination of rabies by 23rd. So I think I would like to request you join me to appreciate all your efforts, all the panelists from Dr. Maria Flavia Nakanjako, Professor Sarah Cleveland, Dr. Cyprian, Dr. Alceda King, Professor Sumbi, as well as our Professor Emeritus, Professor Lord Trees. Thank you very much for being there with me. We have had a discussion from 2 p.m. Uganda, East African Standard Time, up to now. It's exactly 15:38 according to East African Standard Time. So we have hit 8 minutes out of range. Allow me to stop here. The session has come to an end. I appreciate all your comments, clarifications, inputs to make sure that this session has been a success. Our members in the audience, in the chat room, thank you very much for your participation in this kind of session that has been focusing on ending rabies by 2030. I'd like to come to an end, to bring this session to an end. I have been your host, the chair, Clovis Kankia, Associate Professor in the College of Vet Medicine, Makerere University. Thank you. That brings us to the end. Thank you for being with me in this session.
Thank you very much. Thank
Thank you, everyone.
Thank you all.
Thank you.
Thank you for hosting and for the invitation. That was great.
Yeah.
Thank you.
Bye.
Bye-bye.